If you took off your skin, could you just put on someone else's?
That must be painful.
Well, doctors would have to carefully remove it from their body without causing any damage.
So that device right there is called a dermatome. It's used in skin graft procedures if someone's missing skin or in severe burns that need some of their skin replaced. So usually this is taken from another part of the body where you do have skin, where you use this to replace the skin that you've lost.
Then they'd need to cut it into grafts and attach each one to your body, making sure that it fits perfectly. But even if you managed to make it fit, your immune system would attack the new skin, most likely causing it to be rejected.
So that is correct. So using other people's skin technically is possible, but it would be a temporary solution. This might be in someone who has a large burn area or something like that. I'm not sure who would volunteer their skin to be removed.
If you cut off your hand, a small device could be implanted next to your arm bone. Now, this device sends electricity into the wound, which causes your cells to multiply instead of heal. As they do, they change into muscle, bone, and nerve cells. And over the next few years, new tissue would start to grow from the wound, meaning in the future, you might be able to completely regenerate your hand.
So this is not really reality yet for humans. You can't really regrow a limb after it's cut off, but this is something being studied, and it might be promising in the future when you bring stem cells and everything else into play. And so right now, this is just not possible.
If you lose a piece of your fingertip and you're a small child,
Not a good idea to play with knives like this.
a scab will begin to form over the injury.
So if you had something like this, you definitely want to see a specialist like a hand surgeon for sure, as fast as possible.
Underneath, special cells begin to gather at the wound site, and in some rare instances, these cells replicate to rebuild the bone, skin, and nail, regenerating the lost fingertip.
Why this happens? Because younger children have active stem cells, which have a higher regenerative capacity. And some researchers think that tissue in the fingertip is similar to what others seen in regenerative animals like salamanders, so making this possible, but only in young children. And it doesn't always necessarily happen.
If someone is choking, you can stand behind them, wrap your arms around their waist, and shove your fist upward just above their belly button. This sudden impact forcefully pushes air from the lungs up into the throat.
This is obviously called the Heimlich maneuver or abdominal thrust maneuver.
The pressure builds as air accumulates behind the food until it dislodges the blockage, which clears the airway. And while this maneuver can be life-saving, it can also break ribs and cause bruising.
This should only be done if there's complete obstruction. There are complications with this that can happen, but it saved more lives than it's hurt people.
How to remove earwax the right way. Ever feel like your ear is clogged? That could be because of a big chunk of earwax.
So this is called cerumen impaction, and it can cause significant problems.
This waxy stuff is made by your body to protect and lubricate your ears, but sometimes it builds up and hardens, making it tough to hear. A lot of people use cotton swabs to get it out, but that usually just pushes it in deeper.
Yes, Q-tips are never recommended for this.
Instead, experts say you should use over-the-counter ear drops. These drops soften the wax so it can come out of your ear naturally.
I would avoid cotton swabs, gentle cleaning, keep your ears dry. In summary, use earwax softener or warm irrigation with a bulb syringe. And if that doesn't work, seek a healthcare professional.
Ever wondered how a tracheotomy works? When breathing is obstructed, a doctor makes a small incision through several layers of skin and tissue in the neck.
Tracheotomy tube is used when the upper airway is compromised or when a patient needs long-term ventilator care.
They insert a tube into the windpipe, bypassing the blockage and allowing air to flow directly into the lungs. It's a critical, life-saving procedure that can restore breathing instantly.
It's crucial for individuals who cannot breathe on their own or need respiratory support. This procedure is very life-saving when it's done properly.
You would strap it to your back and stick the syringe in your arm.
So this insulin pump from 1963 was actually invented by a Dr. Arnold Kadish.
This would take a tiny sample of your blood and measure how much sugar was in there. A pump would then inject insulin through a second syringe, which would keep your sugar levels stable. But it ran on heavy batteries, making it difficult to carry, and it needed to be constantly checked to make sure it was injecting the right amount. Sleeping with it would be impossible, meaning it was never sold.
The pump was not widely adopted or ever commercialized for all these problems. And fortunately now, the new technology is such that you just have a little implantable device. It's amazing. It's tiny compared to this. So it's amazing how technology has evolved over the past 60 years.
When a blister forms over a burn, some people think they should pop it, but this exposes the wound to bacteria.
So you should never pop a blister over a burn. If it's extremely large and causing a problem over a joint, you should seek medical advice and professional in order to do that in a sterile environment.
Meaning it could easily get infected. And once it does heal, it's more likely to leave a scar. You see, when the blister forms, it fills up with fluid, and this locks out germs, protecting the raw skin underneath and speeding up healing, which is why you should just let it go down on its own.
You want to cool the burn quickly when you have a burn. You want to cover it lightly with a sterile, non-stick dressing to protect it, and you want to avoid pressure. Don't wear anything tight or shoes over it.
If you peeled off all your skin, your body would lose moisture almost immediately, causing severe dehydration. Next, you'd have no barrier to stop bacteria.
So you'd have massive fluid loss. I mean, this is what happens in burn patients when they lose a significant portion of their skin. Also, the greater amount of skin you lost, the less chance of survival. 100% burn patient is like 100% death.
So infections would spread quickly through your body, and you'd also lose heat quickly, leading to hypothermia. Finally, exposed blood vessels would leak fluid, leading to shock, a drop in blood pressure.
Yeah, organ failure, including the kidneys, heart and lung, all this would unravel and fail.
That stops organs from working, and within hours, it would be impossible to survive.
You'll also be in severe pain if all your skin peeled off as well. Burn patients are in an extraordinary amount of pain.
Seen someone with extra fingers or toes? It's called polydactyly.
So this can be genetic and environmental. Also, some people basically have these and don't have any problems whatsoever, but they can also be related to certain syndromes, which are genetic.
This happens when a small change in genes sends extra signals while a baby is developing in the womb. As a result, an extra finger or toe forms. Some are fully functional, while others are just small bumps. Would you keep an extra finger if you had one? Let me know.
So would you keep an extra finger if you had one? Well, most people are otherwise healthy. It can be related to sometimes exposure to certain chemicals during pregnancies, which can cause this, but also certain syndromes as well.